Hello, welcome to this presentation on the Informus Food Provision module. My name is Dr. Marva Ahmed from the University of Toronto, and today I'm going to be talking about the assessments of the nutritional quality of foods and beverages provided in the publicly funded settings and its policy implications. So this module aims to monitor the foods that are provided or sold in three key public sector settings, namely the schools, hospital, and recreational and sports settings. The data collection and evaluation within this Informus monitoring framework consists of two components. In component one, we compile the information on existing food or nutrition policies and programs within the settings. And in component two, we look at the quality of foods provided or sold in these public sector settings and evaluated relative to existing national nutrition standards or voluntary guidelines. I would like to first start with the broad overview of the current state of the food provision module across the various regions, but particularly I'm going to be focusing on the school food provision for this presentation. However, keep in mind that the methodology that I described can be expanded to the hospital and the recreational settings as well. So we know that many public sector settings have limited nutrition policies or programs in place, and very little information on the nutritional quality of foods in these settings have also been collected. Globally, schools seem to be the public sector settings where most efforts to implement, monitor, and evaluate nutrition policies and programs have taken place. Schools are also identified as fundamental settings for establishing healthy eating patterns, and recently they have gained significant attention, being identified as a priority at the UN Food Systems Summit. So we recognize that there's a profound impact of nutrition on the development of children. And this particular UN Food Systems Summit emphasizes the urgency to accelerate these efforts in ensuring the schools have become hubs for healthy and sustainable food practices. So since 2013, the Informus protocol itself has evolved and been adapted to suit the local context, because we want to recognize that there are diverse needs in relation to the local context. And these protocols then have been adapted to suit the unique requirements for different regions. And this adaptability does allow us for more effective implementation and monitoring, although with some challenges, which I'll discuss a little bit later as well. I also want to highlight this need for coherence and collaboration in terms of the food provision space, which has become apparent. We want to make sure in terms of coherence that the goals of providing nutritious, sustainable food align with the broader global objectives, and that we're able to look at these public sector settings that participate in or comply with these particular policies. And we also want to collaborate in the space to share best practices and pool our resources to really address the challenges that arise in terms of understanding the food provision space itself. So now I want to talk about high-level policy implications of monitoring the foods and beverages in publicly funded settings. So this directly impacts public health as well as our overall well-being. Firstly, we want to look at the policies that are designed to promote and prioritize the availability of nutritious foods and beverages in publicly funded settings can contribute to preventing diet-related diseases and promoting health. Next, we want to see that we have established nutrition guidelines and standards for foods and beverages that are provided in these publicly funded settings. And this ensures that the available options meet the specific nutritional criteria, which supports the health and well-being of individuals. And we also want to think about, if you're aligning these nutrition guidelines and standards for these publicly funded spaces, do we align them with the country's specific dietary guidelines? And how does this, for example, impact the types of foods, as well as food availability, food affordability, and food accessibility in these particular spaces? Next, we want to look at making sure that the policies that are implemented must be regulated and to ensure compliance with those nutritional standards. So this certainly have policy implications in terms of verifying that these types of foods that are provided to, in these publicly funded settings, adhere to the prescribed nutritional guidelines. And in relation to that, we want to also think about monitoring and evaluation that is part of the food provision module to ensure that there's ongoing monitoring and evaluation to assess the effectiveness of these implemented strategies. And it can also help us make informed decisions and adjustments to improve the impact of nutrition-related initiatives, as well as for accountability purposes as well, and to strengthen those standards that we have in relation to nutrition guidelines. Food procurement policies play an important role, particularly when we think about having sustainable models for procuring healthy foods. And this can also ensure that requirements for suppliers in terms of meeting nutritional standards and criteria for the foods provided in those publicly funded spaces. Next up, we have education and awareness. So for example, having an understanding or raising awareness among the public of these particular types of foods that are provided in these publicly funded spaces, does that lead to an increased demand for healthier food options? So that's something that will have policy implications as well. We can also look at subsidies and incentives. So for example, governments may provide subsidies or financial incentives to encourage the production, distribution, and consumption of nutritious foods. This can also link in terms of having more affordable and accessible, healthier options in these publicly funded settings. And the last two we'll just cover are looking at equity and access and diversity. So those policies should address issues of equity and access to nutritious foods, ensuring that all populations have access to healthy options in these publicly funded settings. And overall, we also want to have these policies that support research and innovation in the development of new nutritious food, as well as the availability and accessibility of these particular foods as well. So this is just an overview of the space that the Informus Food Provision module is currently active in. There are other countries with policies to improve nutrition in public schools, including mandatory standards for foods available, having restrictions on unhealthy foods available, as well as having fruit and vegetable initiatives and bans on vending machines in schools. Ideally, the nutritional quality of foods should be measured against nutrition standards or guidelines that are established to meet the policy objectives of the particular jurisdiction. So for example, nutrients of public health concern can vary by country. In low middle income countries, the policy goal may be perhaps to improve the micronutrient deficiencies, while in high income countries, it may be to reduce the intake of sodium or fat. I will now provide examples of ongoing activities across the different regions that are looking at monitoring the food provision in publicly funded settings. We're going again to use the example of schools specifically for this presentation. So in Brazil, there have been evaluation of the Brazilian school feeding program, and the Brazilian team have been auditing schools to assess the availability of particular food options that began last year. In Brazil, there are also principles for provision of school meals in Brazil, including that students have a right to school meals that provide them with food and nutritional security, that the food provided should be healthy and respect local culture, and the nutrition education should be part of this particular program as well. And in 2020, guidelines were modified to ensure that there's reduced acquisition of ultra-processed foods, as well as to limit the consumption of ultra-processed foods, as well as ban certain types of ultra-processed foods. In Jamaica, there have been quite a few challenges, although there are interim guidelines for beverages that were created pending the completion of the National School Nutrition Policy and Nutrition Standards. However, there has been a little support from the government. So they are looking at investigating school food environments in Jamaica and Barbados and comparing it with other countries. They're also looking at developing instruments which are suitable for the environment, as well as consistent with the international literature. In Guatemala and Costa Rica, there's been work planned in looking at food provision in schools, and they've also looked at validating food retail protocol for low middle income countries, and with a focus on areas around schools from low socioeconomic urban areas. So there's protocols that are available for Spanish-speaking countries. There's a protocol looking at mapping food outlets and advertising around public schools in Costa Rica. And there's also a protocol and taxonomy to evaluate these food outlets and advertising around and within schools, as well as in food retail in school kiosks and water availability. In Mexico, the food provision module in primary schools have been completed, with results showing only 1% of schools fully complying with the guidelines. Data collection involved visiting each school, interviewing the principal, and evaluating what was sold in the school canteen, as well as the aspects of food promotion and water provisions that were important in the national policy and guidelines. Some of the strengths in Mexico was that it was not based on self-reports, so we will cover that aspect in our methodology as well, but it was verified by the data collectors. However, there were limitations in terms of the geographical reach, and it was quite time-consuming as well. Recently, however, there has been a reform to Mexico's education law that mandates healthy school food environments for all levels of education. And this reform bans in-school sale and marketing of prepackaged foods and beverages with excess nutrients of concerns, as well as bans making mention of foods with poor nutritional quality or foods that put children's health at risks. It also looks at fostering consumption of unprocessed and locally produced foods as well, and safeguarding national school food guidelines as well. In Ghana, the food provision team adapted the 2013 Informus Food Provision Protocol. We're looking at those two components that I mentioned earlier. And with that, they also integrated stakeholder mapping and community readiness assessment. So in terms of the community readiness model, they aim to assess how ready community stakeholders are and whether they have the capacity to implement interventions to improve children's food environments. In terms of the net mapping exercise, they looked at the linkages between the different actors that are involved in terms of the food provision, as well as the influence on mapping. In South Africa, the National Dietary Survey was conducted in 2021 with extensive evaluation of school food environments and school feeding programs. The situation is quite similar to Jamaica, with several informal and small food outlets outside schools, as well as sometimes tuck shops within the schools themselves. In Ireland, the evaluation of national programs promoting healthy foods have been going on, but there's more that needs to be done on national food environments, and they're hoping to collaborate and implement the tools that was used in New Zealand. We will cover that in the next slide as well. And that's also available through the Informus Food Provision website. In Iran, there have been some work that have been carried out on school food environments, particularly in relation to marketing and advertising, for example. The research team in Australia are currently or have been conducting the National Survey of Australian Early Childhood Education and Care Services, and that has been completed. There was a similar survey that was looking at examining the food environments in the Australian school setting last year as well. Australia is also focusing on planning a national survey in school in this year, as well as ongoing monitoring as well. In New Zealand, the food provision was completed in the 2016. This was an online survey complemented with some on-site visits to validate the menus as well. They found some adaptations to the tool, and now they're testing it out in different regions as well. So that tool is available in terms of looking at it in relation to usage for different countries and context. In Canada, the Informus team have sent out a school food environment survey. We have received back about a response from 101 schools thus far, and we continue to expand on collecting some of this data from different regions as well. ongoing, and in relation to that, we are separately from Informus, there's a school nutrition research initiative called the Feeding Kids Nourishing Minds, which is a comprehensive study which is looking at a landscape understanding of current school food programs in Canada, its characteristics, as well as understanding of the funding model. And we also looked at in terms of the best practices in relation to delivery and resiliency and adaptability of these programs as a response to the COVID-19 pandemic. In addition, we're also conducting a stakeholder analysis of understanding the perspectives of key stakeholders, including parents and caregivers, school staff, and program providers in terms of implementing school food programs. Next year, we plan to go into schools to collect data on understanding the impact of school food environments and school food programs on children's dietary intakes and nutrition knowledge, attitudes, and behavior as well. In terms of work on hospital and recreational centers, there's ongoing work. However, there are challenges we have encountered in terms of it being time consuming. The data is not always easily accessible, so we continue to build collaborations, connections, which we have understood to be a key factor in terms of accessing this data to monitor the foods in these publicly funded settings. Now I'm going to give a high-level overview of the protocol and its framework. So as I mentioned earlier, data collection and evaluation within the food provision module consists of two components. In component one, we are focusing on information on existing food or nutrition policies and programs within the settings. So we also want to know that it should provide a comprehensive review of the standards, the nutrition standards and voluntary or mandatory guidelines, because this will allow us to better understand learnings for those jurisdictions that have not yet established these particular guidelines or undergoing review of existing ones. In component two, we focus on the quality of foods provided or sold in public sector settings, and that's evaluated relative to existing national nutrition standards or guidelines. So the resulting data really should inform the implementations of policy and programs, as well as monitoring systems in individual countries and regions. So in component one, this component involves a search for information on nutrition policies and programs in place and associated nutrition standards or guidelines. And descriptions of such policies and programs can be compiled by performing a literature search, as well as gathering information from key informants, government websites, and departments and organizations as well. So we want to look at documenting the following information. First of all, identifying the nutrition policies and programs that exist within the country. For example, school food policy programs related to school food lunches, meals, policies on types of foods, on field trips or fundraising, and types of food sold in vending machines or canteens or cafeterias. We also want to look at details of policy and program. So for example, ideally, each policy and program should include nutrition standards and resources to guide the implementation and a monitoring framework. And also look at identifying the type of nutrition standards or guidelines which is used in the program. Ideally, a nutrition program should include age-specific requirements and both food-based and nutrient-based program standards. So for example, food-based requirements would include foods to encourage, such as fruits and vegetables, and foods to limit that are high in sugar, saturated fat, and sodium. And nutrient-based would be the amount of nutrients in a food, for example, the amount of sodium that is used to include or exclude a particular food that is provided or available. In component two, it is recommended that the quality of the food environment is measured against the region's nutrition standards or guidelines. And if the nutrition standards or guidelines are not available, the nutritional quality of foods can be compared with standards from a similar jurisdiction or region or other authoritative body or other appropriate standards, which is used for defining healthy foods and beverages. We want to look at the status of monitoring and the monitoring data that is available. And ideally, the monitoring data available should have sampled a representative portion of the population using a third-party review and should be periodically conducted. On the next slide, we'll go over the various approaches in monitoring data, but it really should include the number or proportion of the population that is participating in or complying with the program or policy, and a more detailed assessment on the nutritional quality of the foods. One of the key considerations is the sampling design. For example, for monitoring of the school food environments, as the number of schools in a country can vary and can be quite large, a representative sample of schools should be selected based on a random or proportionate to size survey designed to ensure the representation of the population. The choice of sampling frame can also consider local input and country statistics or region statistics. And information on compliance and menu offerings can also be collected from key stakeholders or principals, administrators, or food service providers as well. Evaluations of foods which are sold or provided can be thus evaluated using a survey, or it can also be done through an on-site visit of a representative number of schools, of course, depending on time and expertise and resources available. Now we're going to discuss various protocol approaches from minimal to optimal. To assess, and really this is important because in order for us to assess and increase the comparability of data across surveys and countries, we want to look at measurement instruments that should aim to include key health indicators that are selected according to their scope, robustness, and validity. In terms of our minimal approach, we really want to look at the data which should quantify the number or proportion of the population that is participating in or complying with the program. For example, the number and percentage of participating sites and number and percentage of individuals attending the schools participating in or complying with the program standards. This can be particularly important when the participation is voluntary. In terms of the extended and optimal or recommended data approaches, we want to look at a more detailed monitoring system that should assess the nutritional quality of foods using both the food-based and the nutrient-based standards or assessments. And ideally, they should be measured relative to the nutrition standards which are used by the region or jurisdiction. And we can also look at mapping the food environments around these publicly funded settings. So for example, we can map the number of food outlets around a school, for example. In terms of an optimal approach, it extends what we have gained from the minimal and extended approach, and it should include both quantitative and qualitative aspects where appropriate. So for example, qualitative assessment is going to include information from key stakeholders, and data can also be collected at multiple representative locations and sites across a broad range of socioeconomic and geographically diverse areas. So although the overall aim of the food provision module is to really create a consistent and graded system in terms of monitoring and allowing us to compare within a region and between different regions and countries, and also to ultimately improve the quality of foods in publicly funded institutions, this can become quite challenging. And I want to talk about some of these challenges that we have encountered as part of a food provision team. So for example, when we think of assessing school food environments across countries, it does involve comparing various aspects of the food provided and the overall environment in the schools. And these challenges can really make it difficult to conduct cross-country comparisons. So as an example, countries have diverse cultures and dietary preferences, and what is considered acceptable perhaps can vary widely between countries as well, in terms of the types of foods, in terms of portion sizes, as well as in terms of nutritional standards. We think about having each country having their own set of regulations and policies around school foods and the types of foods that are provided within schools. So this can affect the types of that foods available in nutrition standards and food safety measures. And of course, this also leads or links to the development of the tool in terms of capturing that particular data from those schools. We also think about economic factors that play a crucial role. For example, low and high-income countries can differ substantially in their absolute financial capacity to implement and monitor these different nutrition policies and programs. But at the same time, many of these nutrition policies and programs can also compete with each other as well. And this links to the infrastructure and resources that are available for particular provision of foods in schools or school food programs. So for example, what types of kitchen facilities, staff training, and logistical capabilities that are available that can impact or affect the quality and variety of school meals. The availability of locally sourced and culturally relevant foods can impact the nutritional content of the foods that are provided or sold in the schools, as well as agricultural practices and food supply chains can vary, which can also influence the accessibility and affordability of certain food items, for example, based on seasonality as well. The other thing that's important to note is that monitoring can also be difficult in regions where food is not centrally provided by schools. For example, in some areas, foods may be provided by small independent businesses, which can be more difficult to assess as well. We also look at social and environmental factors, such as the marketing aspects that we do aim to monitor, but they can certainly shape the school food environment. And then, of course, there are differences in policy implementation and compliance and enforcement. So, for example, in some countries, assessing the implementation of or adherence to nutrition standards can be quite challenging. For example, in Canada, the nature of food service varies within provinces and school districts, and many smaller caterers or organizations may not have full food composition data to assess the compliance with the standards as well. And lastly, we want to look at the impact of the school food environments, for example, in considering health indicators and outcome, and think about measuring or collecting this data in relation to for example, in relation to the health outcomes of students. But this can be quite challenging as well. And lastly, we want to think about data collection tools, which can be quite different across different countries, because different countries will use different criteria, tools, and metrics for assessing school food environments based on what I've discussed in this list. And those, therefore, standardizing data collection methodologies can allow for reliable comparisons, but be quite challenging in this space. So now you may be wondering, what approach can I use in my research, or how do I start monitoring or compiling information for school food environments? A good place to start is with, what are my research objectives? And of course, this will link to the time and resources and expertise that is available in terms of understanding the nutritional quality of foods and beverages provided or sold in publicly funded settings. A link to that is understanding the feasibility of requesting data from schools or other publicly funded settings. So, for example, this can be done through asking school staff or principals to capture that data, or it can be done through a third-party review. But again, this will require more time and resources and expertise on the team as well. There are tools and guides that are available for implementing, monitoring, and evaluating food policy and programs in public sector settings from various countries and regions. So it is advisable to consider adapting the tools to fit the specific context. And of course, to look at the literature and data that is available for the country in terms of understanding or monitoring the foods and beverages that are sold in publicly funded spaces. What we have also learned from our own research is building community partnerships has been quite key in accessing this particular data and helping us monitor this data on an ongoing basis. And lastly, of course, we want to think about what is the current situation in my country and region. So for example, in any country, the public sector is influenced by many different organizations, as well as funded through various revenues. So we want to also think about where there might be public and political support to successfully implement and successfully monitor a particular policy and program. And this can vary by country. And assessments in a country should also perhaps consider assessments at different levels. So we look at assessing the system level data in terms of the policy, community, and organizational level that can be routinely measured and included in existing or new monitoring databases, and that can be linked to individual level to better survey the impact of these particular policies and programs. So to summarize and for some future directions, we do want to acknowledge the diverse challenges countries face in providing food for their populations. From production to distribution, we understand the complexities are vast, but what we want to do is perhaps create a more coherent picture and establish a common framework that allows us to compare and analyze food provision activities across countries. Identifying key indicators is quite crucial. We want to consider parameters like policy and program implementation, compliance with that policy and program, food sold that meet food and nutrient-based guidelines, for example. And these indicators can also provide us with a quantitative basis for comparison. We also want to see that the standardized set of metrics will allow us to comprehensively evaluate the strengths and weaknesses of food provision systems globally. Linked to that, of course, is the implementation, which is effective implementation really is the backbone of any successful food provision strategy. And we want to help us understand the effectiveness and compliance of such initiatives. And this can foster accountability, but also allows us for sharing of best practices across different countries. And lastly, we want to consider incorporating environmental sustainability metrics, which can assess the impact of environmental consideration. And help us move towards more of a sustainable and resilient global food provision model. So I'd like to end by acknowledging the food provision module leadership team and the Informis network. If you would like to get more information, I have put down my contact information right here, and I've also provided a link to the website with our contact information. So thank you very much.